Hello everyone, friends, colleagues, professionals, good afternoon. This is Dr. Lilian Ohanedozi Prince Hill. So a quick one, we're starting our class this evening. If you haven't registered, please do so. This is because we're going to be looking at a whole lot. When we talk about right hemisphere damage, there are a lot of things involved apart from the language disorders that occur as a result of this damage. Now, if you're going to be a speech or a language therapist, you need this because we're going to be looking at visual spatial disorder as well as remediation for visual spatial disorder. Why do you need visual spatial disorder? This is because whenever any part of the brain is damaged, one of the symptoms that most of the patients undergo is visual spatial disorders. When we talk about visual spatial disorders, we talk about disruption in place and time. A person's cognitive ability on how he sees things is affected. Because not only language, not only the linguistic aspects is damaged whenever there is a brain injury, cognitive aspects, executive functions are affected, of which visual spatial disorder is one of it. And otherwise, you might find yourself talking to somebody who is not even aware of your presence. Remember, the brain controls the body contralaterally. This means the right part of the brain controls the left part of the body, while the left part of the brain controls the right part of the body. Now, just in case there's RHD, right hemisphere damage, it means that right part of the brain is damaged. And because it is damaged, if the region that controls how the individual views things is affected, you might be standing in front of a person and he can't see you. This is why when you give them food to eat, some of them might just eat half of the plate and leave the left part for you, because once there is RHD, there's possibility that the person can no longer recognize stimuli on the left part of the body. So the right hemisphere part of the brain is responsible for stimuli on the left part of the body. Now, if that aspect is damaged, you need to test for it first before you start addressing your student. So you don't wonder why this student is not responding to you. It might be that the student is not seeing you, because some of the symptoms the people or students or adults who suffer from ADHD go through is visual spatial disorder. So if the brain injury is on the right hemisphere part of the brain, you would do well not to stand on the person's left part of the body, because he cannot process signal on the left part of the body, except of course with remediation and intervention. So you see, this is the first test you go through. This is the first test you diagnose in the student in order to know how to position yourself properly to get the person's attention. This is why visual spatial disorder, training on it and how to control it is equally important. So we're going to be looking at this and other aspects of language disorders that occur as a result of right hemisphere damage. So I look forward to seeing you in that class. If you have not registered, please do well to register. It's going to be interesting and interactive. You can also come with your questions and we'll find a way to deal with it. Okay? So enjoy your evening.